Great.
Okay. Good morning, Dr. Leonardo. Let me thank you very much for being on the show. I really do appreciate your time and the acceptance of the invitation.
Thank you, Mr. Reda. It's for me a pleasure to be here, and I like you. I like to thank you very much for the invitation, and for me, it's a pleasure for sure.
You are most welcome, Doctor. Doctor, let's start the conversation with introducing the audience to who is Dr. Leonardo. Just give us like a little backstory on your experience, please.
Yeah, I'm ophthalmologist specialist. I work in ophthalmology for more than 16 years. I'm originally from Brazil, and I'm living in UAE for around 2 years. I joined my actual company 1.5 years ago, and it's been more than a pleasure to be here in this amazing community. I come from a country, a very large country as well, but the mix of culture we have here is something really amazing, something quite unique. So it's a great opportunity to see many different cultures, and also surrounded by technology and everything that an ophthalmologist looks for. Ophthalmology is a field that we are very integrated between science, body, technology, and why not say soul. So I guess it fits well with your show here.
Yes, perfectly. It fits perfectly. Doctor, just let me ask you, how different is the practice of ophthalmology in Brazil back to over here in the UAE? Like, what differences have you noticed as an ophthalmologist?
Yeah, first, the access we have to technology, and we depend too much of technology to check the eyes, to proceed the surgery. We need the technology, and thankfully we have access to this technology here, and worldwide it's very similar. So I don't see so much difference between the technology. But of course, the approach is different. We are talking about Brazil, is a third world country, and here it's as I mentioned, it's a very mixed culture of people, different cultures. So the great difference is, of course, in Brazil, most of the population don't have the resource we have here, unfortunately, and we still have long queues for eye treatments, and that's the biggest issue that we face in Brazil. But on the other hand, we have very dedicated and supportive doctors, and I think that's the difference from the Brazilian team in terms of health. We know the issues that the population has, and we try our best to enhance the experience and try to bring them the opportunity to have a good side to treat the health problem. And comparing here, of course, we are more comfortable, and that's the main reason for me to be here, because I can offer the best options in treatment, the best technology, and also mix with the great approach I had in my background in Brazil.
I see. Doctor, have you noticed like any differences in the problems that you faced, let's say, with the community in Brazil from problems related to the eyes compared to here in the UAE?
Yes, every place they have their issues, their differences. In Brazil, of course, we have much more elderly patients than we have here. The population is older because this is a new country, too much foreigners, too much expats, and the community is quite different. So in Brazil, of course, we have much more degenerative issues, and also regarding the geographical position from Brazil, there are specific issues, specific disease related to UV exposure, to the environment, and also, of course, the healthcare that we have there is different from here. That's the main difference. And here, one thing that we it's quite different. The environment is very, very dry here. We know that Dubai, Abu Dhabi, all UAE, it's kind of humidity place, but everybody lives indoor. So the indoor environment is a dry environment. And for the eyes, we see much more dry eye disease, much more allergies than we see worldwide. So there are some specifications in different places that we can notice.
Doctor, you mentioned that the UV light affects our eye. In what sense, let's say, how does the sunlight affects our eye? Badly or positively?
Yes. There are two, of course, balance is the secret for everything. We need the sunlight, we need some amount of UV exposure. More and more, we know there is what we call the myopia epidemic. Myopia is the nearsightedness, and we are aware about the increasing of myopia. For example, we estimate that it will increase very much for the next years. In 2010, for example, 28% of population worldwide had myopia or were nearsighted. And there is an estimate that in 2050, almost 50% of population will have myopia. And one of the concerns, one of the main reasons studied nowadays is the indoor environment and more using of gadgets, cell phone, tablets, the close reading, and we don't use the outdoors as much as we used to do before. And one of the studies they signed that we need the light exposure, the natural light exposure. We need to outdoors activity. So from one side, UV light can maybe prevent a little bit the progression of myopia, but on the other hand, in area that the population is too much exposed to the sun, we have more cataract, we have much more macular degeneration, the back of the eyes, the retina. We also have some lesions on the surface of the eye, the pterygium. Pterygium is like those membrane we see on the cornea outside the eye. So there are many eye diseases that are related to the UV exposure. So it's important to have outdoors activities, but also wearing UV protection, sunglasses, or even the regular glasses, they have this protection as well.
I see. Doctor, before we get into, let's say, the diseases and the problems and how can we solve them and how do you treat them, let's just start with the structure of the eye. Like, can you please give us like an overview of the structure of the eye and the usage and the purpose of each part, let's say?
Yes, of course. The reason for me to become an ophthalmologist is because I'm fascinated by the eyes, and the eyes are perfect machines, very complex, very delicate, and brings us so many gifts. So I say that sight is a gift, so you need to take care. So to understand the eyes, I like to compare the eyes like an old camera, the, the regular camera we used to have years ago, and this camera is responsible for capturing the image that we see. We have basically three interfaces in the eye. So the eye, they are composed by two lenses. One that we can see outside the cornea, this lens outside. The second lens is behind the pupil. So when you look to somebody's eye, there is this black circle, the pupil. It looks like a spot, but there is something behind. The eyes, it doesn't stop there. So behind the pupil, we have this lens, the crystalline lens, and those two lenses, they are responsible to focus everything we see on the retina, the back of the eye. So the retina is a membrane where the vision happens itself. So once the vision happens in the retina, all this information is taken to the brain by the optic nerve, the cable that connects the eye to the brain. So our visual system depends on the eyes, the eye globes, the two eye globes. They are connected by each other by the optic nerves, and the brain is like the screen. So we have two cameras, we have two eyes, we have a cable connecting both to the screen that is the brain. So the visual system starts in the eye, but it finishes in the brain. So it's a very complex and very delicate system. And I used to say this phrase I heard in the beginning of my studies, that the eyes, they are small only in size. They are very complex,
Mm.
really new world with many possibilities and of course some issues, but it's a wonderful land, let's say like this.
Mm. Beautiful. Doctor, the retina. I read once that, let's say, if it was inflamed or it had a problem, it's very hard for it to recover. Is that true, or is there any wrong statement to this statement, let's say?
Yeah, retina is the most sensitive area of the eyes. It's in the back of the eyes, well protected down there, and it's a membrane with many neurons and many nerve fibers. And those membranes, they have vessels and they need a good nutrition to work properly. And they have
Mhm.
very intense metabolisms. So inflammations or any cause related that affects our body, for example, diabetes, hypertension, many inflammatory diseases that we can have in the body, they can affect the retina as well. And once the retina is affected, or by inflammation, or by trauma, or by infection, it's very delicate to treat. But of course, nowadays we have many new technologies, medication, and more we have less visual loss regarding retinal problems. But of course, retina is a part of the brain. They have the same
Mhm.
cells that we have on the brain, so they are very delicate. And some of those, they cannot regenerate. So once we lose any of those cells, we cannot regenerate. So it's important to be aware, to protect the retina, to avoid those issues. But in most of cases, we have good treatment and excellent results for retinal diseases.
I see. So from what I understood is that the retina it's a part where it's hard for us to fix later in the future. So the question is, how can we take care of it before? Like, how can we, let's say, take care of the retina from nutrition and lifestyle habits?
Yes, more and more we see, and it's nice in healthcare as well, trying to prevent, not only focusing on treatment, because treatment, I think it's quite late. We could do more. We could prevent the issues. And retina is a good example for that. So, how to prevent retinal issues? Just to understand, the most common retinal diseases are first, diabetic retinopathy,
Hmm.
macular degeneration, and retinal detachment. Those are the most common issues on the retina. And also, we cannot forget some strokes that we have on the retina caused
Oh,
by hypertension. So, controlling these factors, good nutrition, good activities, healthy lifestyle will reduce the risk of diabetes, reduce the risk of hypertension. Also, as we mentioned before, be careful about sun exposure. We know nowadays the macular degeneration is one of the leading causes of severe visual impairment in patients
hmm.
over 60 years, 70 years. And protecting the retina from UV exposure helps a lot. And most people, they don't know, but if you wear regular glasses, you are protecting your retina. They have UV protection.
Uh-huh.
For we don't know, but UV protection is not related to the color of the lens. It's transparent. The UV protection is transparent. So when we use sunglasses, they have color. They are black or brown, depending on the color you choose. The color of the lens is just to give you comfort, but the
Hmm.
protection itself is transparent. And also, who wears contact lenses? Most of contact lenses, they have UV protection as well. So wearing your contact lenses, if you wear contacts, glasses, you are protecting your retina. And nutrition, the diet you take, the food you take is paramount for your health as a whole. In the eye is not different. Of course, if you eat a lot of carrot, it won't change your quality. There are some myths. I like to joke in Instagram, and I like to share those things to give more information for patients. But of course, there is no vitamins that you can take that will enhance your vision. Of course, the lack of vitamins can cause some issues. So a balanced diet is enough for you to have a good nutrition for your retina. And I remember I had a patient, it was a teenager, I don't remember, and I spoke to him, if you want to prevent your vision, because he has some relatives with macular degeneration and some issues with the retina. And I spoke to him, you need to have a colored food. When you look to your plate, it must be colored. So it's the right way. And he joked with me, so can I take M&Ms? Am I fine? And not this kind of color, but the food should be colored. But that's it. A balanced diet is enough, and of course, exercise, activities. That's the way to have a good life, good health, and also the vision.
I see. Doctor, is it like, for example, because I know that as we grow old, like our eyes degenerate and the vision degenerate automatically. Can we, let's say, run away from it? Like, is it possible, or can we stop it or slow it down?
Yes. Well, our eyes, I used to say this, they are made to last more than 10 years, more than 100. But there are some issues like we have on the skin, on the hair sometimes. After some years, we have some loss. And one of the greatest change, unfortunately, we cannot fight against yet. There's no medication yet to prevent this. Is the presbyopia. Presbyopia is the struggling for reading close. We start struggling close after the 40s, the 50s, and that's something that almost nobody escapes. And besides the presbyopic, which we can fix with glasses, we know that after some age, the cataract is something that can happen as well. And we know, first, UV protection helps a lot. Avoid long exposures to close reading. We have what we call the 20-20 tip. Every 20 minutes for who works on screen all the time, which means most of the majority of people nowadays. Every 20 minutes you spend on your screen, try to take a break, fast break, 20 seconds, and try to find something to change your from close to far, so you relax the muscles you have inside your eyes, and also remember to blink, so you improve your lubrication. So this is like a physiotherapy that you can do, not to prevent presbyopia, but to be more comfortable and to postpone it a little bit more. So it helps you to avoid eye strain and also postpone a little bit the presbyopia. We also see we have many information on internet about some exercise we can do to prevent vision or to avoid glasses, but none of those exercise they can bring back the ability we have to focus after the 45 years, 50 years. So to prevent, we need to have all those measurements I spoke before, balanced diet, exercise, control your blood sugar, your sugar level, control your hypertension. So that's the best way to postpone your eyes issues and to have a better vision.
Wonderful. Thank you, doctor. Doctor, you mentioned the cataract. What is the cataract?
Yeah. Cataract, it means that the lens we have inside the eye, just remember, our eyes, they have two lenses and the retina in the back. One lens, the cornea. The second one inside is a transparent lens. And for many reasons, for age, some chronic eye inflammation, diabetes, as I mentioned, chronic like trauma in the eye, long term of UV exposure. This lens becomes opaque. It's not transparent anymore. So once this lens becomes a little bit opaque, first it will make the power of your glasses change. So some people, they need to change very often the glasses because it's changing after the 50 years, 45 years, 50 years, 60. They start changing the glasses all the time because this lens is not so clear anymore. And once it's opaque, you can change your glasses, but you feel that something is not working. That's the lens is cloudy, is dirty, but inside the eye you have this lens, it's opaque. From outside, you cannot say for anyone that he has cataract because you only can notice the cataract if you use some drops, dilate, or using the microscope we have in the office, we can check and see this opacity. And once we have cataract, there is no medication, no treatment to clear it again. So once the lens we have is opaque, we need to replace it for a new one. So it's a procedure, the surgery, and the cataract surgery replaces this natural lens, which is opaque, for a new one that's clear again and clears the vision again. But with one advantage, and I used to say it, nowadays, cataract diagnosis is not a big deal anymore because first, the procedure is a routine procedure. It takes 20 minutes, 30 minutes maximum. Patient can see clearly in the next day or a few days later, completely painless. And we have the opportunity during this cataract surgery, the new lens we implant, we can input in this lens the power of the glasses the patient was used to wear. So it's very common nowadays, patients who has cataract, after the treatment, they don't need to wear glasses anymore. So it's an
Wonderful
advantage.
Can it, let's say, re-degenerate in the future if we put, let's say, an artificial lens, or is that it? We're good for life?
This artificial lens, you mean the lens we implant in the cataract?
The cataract, yeah.
Yeah. Once we implant this cataract, this lens, it's forever. So you set the power of your vision, and the main reason for vision change are the size of the eyes increasing, and it doesn't increase anymore after 40 years, and the lens inside. So once we replace this lens, it's set. And those lenses, you don't need to replace them anymore. So once you implant this lens, this will last forever.
Wonderful. Doctor, correct me if I'm wrong, but is it true, like as we age, the color of our eyes gets lighter?
Yeah. Once we're born, the little babies. What happens, for example, the color of the eyes can change. The iris is responsible for our eyes color, and the iris from the little baby, most of case they born with a lighter color, and they can become a little bit browner. So a little bit brown. So babies with blue eyes, they can become green, but patients who are born with brown eyes, they can't become blue. This because the iris is still changing the pigmentation, but in adults it doesn't help anymore. So why the color of the eyes may become a little bit lighter? Because the cornea, the lens outside, it can get some opacity in the peripheral area, some degenerative change, but those degenerative changes, they don't affect the vision. So just the color of the iris, the color of the cornea, the lens outside, become a little bit hazed on the peripheral area, which doesn't interfere with vision, and you have the impression that the iris changes the color. As this lens is transparent, once it becomes a little cloudy, the color of the iris may look like a little bit lighter, but it's not changing inside. Some cases can really change the color of the iris, but in most cases are intraocular inflammation. So some inflammation can cause the iris to become a little bit lighter, but it's not an advantage, let's say like
I
this.
see. Doctor, I might have like a silly question, but does the color of our eyes affect the colors that we see in nature? Let's say, like, does it affect the sharpness and colors that we see?
No, the color of the eyes do not define the, like say, the the acuity of your vision, the
Mm.
sharpness of your vision, or either how you can see the colors outside. We know that we have some color blindness situations, and those color defects they happen by the retina, because
Mm.
on the retina we have basically three different kind of cells, one for each primary color. So the mix of those cells, they can analyze the real color we see. Some people
Mm.
have one type of cells missing, so they cannot distinguish from some kinds of green and red. It depends. But for the color of the eyes, it doesn't affect at all. Uh, some people with lighter eyes, they may have some light sensitivity, because the function of the pupil is to protect the retina from the light. So once
Mhm.
we are in a very bright place under the sunlight, the pupil becomes smaller. So it will allow less light to come on the retina. So it's like an adjust. And
Mhm.
at night, the opposite. As we don't have so much contrast, the pupil become larger, so we have more light coming inside and we can see better. So the function of the pupil, the iris, is adjusting the size, its diaphragm, it's adjusting
Mhm.
the size as we have in photography in other areas, just to adjust the amount of light we receive. So if your pupil, if your iris is lighter, it means that it doesn't have so much melanin, so much pigment
Mm.
to protect the retina. But it's not an issue. Many patients with brown eyes, they have also light sensitivity. So it depends from patient to patient. But in general, lighter the lighter the iris, more sensitivity you may have from the light. That's why some macular degeneration, like age-related macular degeneration, is the most common we have. It's more often in light color iris.
I see. Wonderful. Doctor, I want to get into blindness. Now, let's start with people who are born blind. Then let's talk about people who lose their sight a long time. So, people who are born blind, why?
There are some malformations since childbirth, some infection during pregnancy, or some degeneration that are inherited degeneration of the retina. It's not so often nowadays, but it can happen. One of the most common cause of blindness in newborn is
Mhm.
glaucoma, congenital glaucoma. Congenital glaucoma means that the pressure inside the eye during pregnancy is so high that it damages the fibers from the retina,
Mhm.
the fibers of the retina. So this pressure cannot be fixed during pregnancy. So once the children, the mother get birth,
Childbirth.
we can diagnose this, see these signs of glaucoma, and we can treat in advance. We can treat as faster as possible, and we can reduce the risk of total blindness. So there are
Mm.
some tests that are done as soon as the children birth, and it's a kind of a light test that's done in the OT, and we can check if the children has some sign that can be caused by the glaucoma. So those babies are treated very early to prevent any greater loss. We have also congenital cataract. Some children, they are born with cataract already. And this test can check this, and we can treat and prevent a deep blindness. But blindness, the full blindness, 100% blindness, is very, very rare nowadays.
Mm-hmm. Why is it becoming more rare?
Yeah,
Like, is it because of the technology, or is
yeah, the care of the maternity is much better nowadays.
Mhm.
In the past, we have toxoplasmosis, one of the leading cause of infection during pregnancy, and was a great responsible for blindness. Also, syphilis, some infectious disease that could harm deeply the eyes. So nowadays, mothers, they treat, they make, they have a good supplementation on their diet. So
Mhm.
to give enough nutrients for the visual system, the whole body of the baby develop properly. So that's the care we have to the mothers. They are paramount to the reduction of not only sight but many other health problems from congenital health problems.
Mm, I see. So actually, the way I see it, like what we eat affects heavily, let's say, the eye health and basically everything, like every part in our body. Like, because the more I speak to different doctors, they always emphasize on the quality of the nutrition and how much of a big role does it have to play in the overall health.
Exactly. And eye is just a part of our whole body. So everything works together, and the eyes, like any other organ, depends of a good nutrition, depends of good activity, because the activity will adjust the metabolisms of the whole body. So we'll set our machine perfectly to work
Mm,
properly. So that's paramount for sure.
wonderful. Doctor, let's talk about diabetes and how does it affect the eyes. Why is it that sometimes if somebody has, let's say, high diabetes level, they can lose their sight? Is it because of the inflammation solely, or is there any other reason?
Yeah, I like to take an extra time to all my patients who was diagnosed with diabetes and come for the first time for the consultation, to make them understand the disease and make them understand the process of eye issues caused by diabetes. The most important
Mhm.
thing to understand, it's not, how can I say, a direct link between
Relationship, yeah.
blindness. So if you have the diagnosis of diabetes, it doesn't mean you will become blind or you become
Mm,
lost. That's the most important thing to understand, because luckily and thankfully nowadays the treatment for diabetes, it's very advanced, and we have many new possibilities. In patients with diabetes, they have a normal life nowadays.
mhm,
So you just need to follow your medication, to follow your doctor, and again to have good nutrition, to have activities. So it's not a big deal anymore to have
mhm,
diabetes. And why the eyes are affected by diabetes. The great issue about diabetes, the great issue about the sugar level to be high, we need to understand that the sugar is essential for our life. We need sugar, but we need it in the right place. So the sugar
mhm,
must be inside the cells, uh, uh, being there to be used when we need to do any activity. For example, if you know our brain, the only fuel for our brain is sugar. They
mhm,
only work with sugar. They don't work with protein, with lipid, just sugar. They need sugar. Our brain, they need sugar. So sugar is paramount for our life. But once the sugar is not inside the cells, it's on our
blood.
circulation, our veins, for example, there they can cause a chronic inflammation. So when
Mhm,
the sugar is higher, these tubes, the veins, they become inflamed and they can suffer. How do they suffer? They small veins in the organs like the brain, like eyes, kidney, and also the edge of our body, like the feet, hands, they can have
mhm,
some defects. So those small veins, they can get damaged and they start leaking. So the liquid, the blood inside the veins, they can leak outside and also cause inflammation. and on the other side, the thickness of those veins, they becomes shorter, smaller, and the vein cannot get the destinies. They get blocked.
Oh,
So the blood will not come to the right place, and they will like split in place where it should not be. So this is a chronic process, a microscopic process. It takes time to cause damage. So, for example, if you talk about type 2 diabetes in eyes, to see, of course, patients we don't have a very high uncontrolled diabetes, but the level that we usually see, it takes 10, 15 years to start having any issue in the eye. So it takes
mm,
time. If you have a well-controlled sugar level, it may take even more. I have patients with 25 years of diabetes, they don't have any issue.
I
Uh,
see.
so it's completely normal to have a normal life with diabetes without suffering from the eye. But if you have diabetes, you don't control well, if you have hypertension together, so those are the two main factors to cause harm on the retina. The retina, as we spoke before, is the most sensitive area of our eyes. And the retina and the eye itself, we say that the eyes are the windows of the soul. And it's true in this case because when we look in the back of the eyes, when we use those drops and we check the retina, we can see clearly those changes I mentioned. And the eyes are the only organ we have in the whole body that we can see directly with our eyes, or with naked eyes, we can see those changes on the vessels. We don't need to use any X-ray, any MRI, don't need to take any medication. You can see directly. So that's why it's so important for patients with diabetes regularly check their eyes. Not only because of the sight, not only to check if their glasses need to be changed, but to see in the back of the eyes, because once we notice, we observe any small bleeding, any small leakage, but it's not affecting the vision yet. But those are signs that in other place they must be happening as well. It can be
Mm,
it can be happening on the feet, can be happening in the brain. So it gives an alert to intensify the treatment and search in other organs to see if everything is okay. So that's the main reason for diabetes affecting the eye. It's damaging slowly and slowly the retina. And of
mm,
course, if sugar causes inflammation, this chronic inflammation will increase the risk of early cataract development as well. In some cases, and that's the most common complaint in, in new diagnosed patient, recent diagnosed patient, they complain about the vision become blurry from out of nowhere. Why it happens? Once the sugar level is too high and it becomes normal, or once it gets high very fast, this changing can also change our focus. So the glasses prescription, for example, for a patient with a high level of sugar, and this level suddenly gets down when they start the treatment, for example, the prescription is completely different. It changes, but it changes for a short period, maybe 5 days, maybe 1 week. So most of patients with high level of sugar, when they start the treatment, they can notice some change in their vision for a while, but it's something that is temporary. It doesn't last longer, so they don't need to be afraid. But it's important to check. So diabetes can affect the eyes in many ways, but the most important information that patients need to know is don't be afraid, because to see some issues in the retina, it takes time. And most of them, if we diagnose it early, the early we treat, the better result we get. And once we see those initial changes, we can do very simple treatment in the office with laser or some medication. We can fix those changes and avoid it to affect the central vision. So even the patients without any visual complaining, they can have those issues in the retina, and if we treat at that time, he won't face any visual impairment. So that's the best moment.
wonderful. Thank you so much, doctor. Doctor, something crossed my mind. How does our vision play a role in our body stability? Does it? Like, does it affect it?
Yes, yes. We say that our stability, our balance,
Mm-hmm.
it's a tripod. Okay.
Mm-hmm.
In this tripod, we need to have at least the two of the three working fine. One
Mm-hmm.
is the, so you need to have the vision to set your body.
Mm-hmm.
And one is the in our ear we have the equilibrium center, the our vestibular central. It's where it let us know if we are standing up or laying down. It can
Mm-hmm.
to notice if you are standing up or laying down, to have our position. It's our natural GPS. So our
Mm-hmm.
natural GPS is here. And the third one is the auto sensibility. Those are on our joints and our feet, that we can notice that we are putting our feet on the ground, we are standing up. So those three main points are the tripod. For example, if you try to stand up and you close your eyes, you won't fall, because
Mm-hmm.
you have those two others important.
Factors.
Yeah, and if you have one of those lost, then you fall. For example, if you have some issues on your cochlear system and you close your eyes, you fall. If you have any
Mm-hmm.
your neurosensitivity of your joints of your feet and you close your eyes, you fall. Or if you have any issue on your ear. So these are the tripod. So vision is essential, but even patients of blindness, they can walk, they can stand up, because they have these other two working properly.
I see. I see. I got your point. Doctor, one more question, please. Like the red eyes, are they only like a factor of dryness, or could there be like something else that we are missing?
Yes, the eyes, they don't have much ways to show us that they have an issue. They can't say what's the problem, what's going on. So the only way they can show us that something is wrong is becoming red,
Mm-hmm.
is having some discharge, blur, become the vision becoming blurry, or having some kind of pain or discomfort.
Mm-hmm.
Those are the only way the eyes can show that they have some issues. In many different situations, they can use the same way to show that something wrong. For example, if you have a conjunctivitis, your eyes will become red, you have some discharge, maybe your vision may become a little blurry or not.
Mm-hmm.
But if you have an infection inside the eyes, what we call uveitis, the eye may also become red, the vision may become blurry. Sometimes you have some watery discharge. If you have dryness, uh, most people they may think that dryness means lack of tears. If you don't produce tears, dry eye, but that's not true. Many patients with dry eyes, they complain about watering discharge. So how is it possible? In fact, dry eye, we use this word to be easy to understand, but it's more a lacrimal dysfunction. Our tears, it's a tear dysfunction, and this dysfunction means that the tear we produce is not how can I say, the quality of these tears is not enough to still coating the eye between one another blinking. So sometimes we have tears, but they are so watery that they can't stand in front of the eye. They just come down and the eyes become dry. And you feel this
Mm-hmm.
keep watering. And the eyes become red because of this. So dry eyes means that the quality of your tears, it's not good enough to protect your eyes, because the tears, they have water, they have some protein, and they have some oil. So they are mixed. They are well balanced. When there is a disbalance between this amount of water, protein, and oil, they don't last longer enough to keep the eyes moisturized. And
Mm-hmm.
red, you may have tears. That's the same, for example, when you see an allergic process, allergic conjunctivitis. People with allergic conjunctivitis, they complain about watering, they have the dry eye sensation, and they also have this redness. So there are
I
some different
see.
causes, but the same symptoms. So only the symptoms cannot, they don't allow us to know exactly the reason for the complaint. So that's why it's very important to check and to analyze what's the cause for the redness, what's the cause for the watery, which kind of inflammation. So the eyes have a few ways to show they have these issues. That's why it's important to check every redness, every eye discomfort to be sure exactly the cause and treat the root.
Wonderful, wonderful. Doctor, men and women, do they have, let's say, the same rate of degeneration or problems? Or like, do you see more problems in men compared to women or vice versa?
We know that for women mainly regarding the hormonal change they have mainly after the menopause, uh, the main difference we see between men and women regarding the eyes are regarding the surface. Dryness, for example, is much more common in women than in men. Um, Cataract, on the other hand, are slightly different, slightly more common in men than women, but it's a minimal difference. But the eye surface is the main reason for this difference. And also, there are some inflammatory disease, rheumatological issues. There are more often in women than in women than men. So those like some arthritis, some rheumatological issues, they are more frequent in women than men, and they can cause some dry eye syndrome as well. So we see much more dry eyes, much more tear dysfunction in women than in men. That's the only point that we see this difference. The other situations like cataracts, minimal difference, glaucoma is almost the same, retinal issues also very similar.
Glaucoma. What is the glaucoma, doctor?
Glaucoma, we can say that glaucoma is a silent enemy because
Hmm.
glaucoma is an issue. What's glaucoma itself? Glaucoma means that there is a damage happening in the back of the eyes, one more time, the retina, but not the retina, the main brain, but the cable that connects the eye to the brain. If you remember, we have the camera, our eyes, and the screen, our brain. And the cable, the optic nerve, that's the one who suffers with glaucoma. So this cable, uh, regarding the pressure inside the eyes, when this pressure is higher, it can press this nerve, and we can lose some of the fibers because they are very sensitive. So during some years, if this pressure keeps high, these cells will be damaged, and the total of cells will decrease, and the quality of vision will reduce. But the reason for the silent enemy, as I spoke, is that we don't have any symptoms regarding glaucoma. Even eye pressure is higher, we don't have any pain in the eye, we don't feel pressure in the eye. May have a slightly headache in some cases, but in most of cases we don't have any important symptoms. And not only in the initial cases of glaucoma, even in advanced case with visual field defect, visual field reduction, the patients don't get aware about this. They don't notice the vision field is reducing, is getting narrow. So when glaucoma, this nerve suffers with the pressure, and the visual field slowly will reducing from outside to inside. So the damage comes from outside, and it takes long to become in the center of the vision. So once the patient has complaining about vision regarding glaucoma, it's a very advanced case. And the problem is it doesn't have any symptoms. It's slow progression. You can notice it's progressing, But the great problem is that we cannot revert once we have this visual loss. So the great issue about glaucoma is that we need to treat before the problem comes. That's the tricky point. And how can we know that we have glaucoma? Only by the ophthalmological consultation, where the eye pressure is checked, also the optic nerve is analyzed. Sometimes we need some special tests just to be sure that is everything okay. Sometimes we do those the visual field tests to check if you have any impairment on your visual field to avoid any damage. So glaucoma is this. And we also have some patients with borderline level of pressure. So we check the pressure is in the normal range, but they have damage on the optic nerve. Those are the most difficult cases because they happen in younger patients. In those cases, we check the optic nerve, and even with low pressure, we need to reduce it even more. So it's a complex scenario, but as I mentioned for diabetic retinopathy, for glaucoma it's the same. It's in general 95% of cases, it's a very slow progression disease. So for glaucoma, to cause an important vision impairment, it will take 15 years, sometimes more. So we have time to check. So if you have annual eye test, annual visit to an ophthalmologist, or 1.5 years, it's time enough to check, to notice if you have any change, and you have time enough to treat to prevent any visual loss.
I see. I got your point. Doctor, to finalize, is there anything that you want to share? Maybe something that I missed, maybe something that I didn't ask about. Is there something that Dr. Leonardo want to share from your experience before we close up this episode?
What I like to share is the vision is a gift. We need to be very careful with our eyes, protecting our eyes from UV exposure, wearing glasses for outdoors activities that you may be in risk of having any trauma. Be very careful with your eyes, and of course, having a balanced life, balanced diet. Do not forget to have exercise, a routine, a healthy routine. I guess your podcast here, your show, the main reason for your show is to find and to give your audience the understanding that we need to have a balance, because the body attributes to this. So this once we offer our body plenty condition for working properly, we get this gift back. So the vision is the same. So if you want to have a healthy sight for a long time, you need to start step by step. Do it step by step. Every day, take care of your body, take care of your mind, take care of your routine. And the eyes are the window of the soul. So we need to clean this window every day. So for sure, positive thoughts also helps. A good smile, good activities. That's the secret.
Wonderful. It sounds so easy when we say it, but like people cannot do it. It's so hard to apply.
Yeah, I know.
Doctor, thank you so much. I can't thank you enough for today, for your time, for your experience, for your talks. I really wish you all the best and nothing but happiness for you and your family. I wish to see you again in the future. Thank you so much.
For sure. Ms. Reda, once more, thank you so much. Thank you for your audience. And hopefully in future talks, I'll be here again.
Of course, doctor, I would love to. I'll see you later.
My pleasure.
Thank you, doctor.